Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, February 24th, 2022, and I know lots of folks are feeling excited, lots of folks are feeling a little nervous as we look ahead to Monday, February 28th, when, as we announced Tuesday afternoon, we are in a place to lift some of the mitigations that have been in place at the city level for some time. We'll be lifting both the indoor mask requirement for public settings, as well as the vaccination requirement for certain high-risk settings. The need to show a vaccination card, for example, for restaurants or bars or fitness centers or large entertainment venues that are serving food and drink. And we talked a little bit about where some of those metrics are, but I wanted to just, again, go over some of them with you. We've gotten a number of questions in about how that relates to CDC, et cetera, so I'll address some of that in a minute. As always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. So as always, let's start with our dashboard, chi.gov/COVID-, and all the news here continues to look really good. We are down to just 270 cases per day right now, really getting very close to that 200 mark. I wasn't sure we'd ever see that again, given how much more testing we're doing compared to what we were doing last summer. Continues to drop more than 30% week over week, and you can see this really coming down a nice low level. Hospitalizations, this is new Chicago residents being hospitalized. We're at 22, which is good, because on this, when we look kind of across the country, we very much like it to be under 1 per 100,000 per day, broadly speaking. This is good, especially when you see how quickly that has come down. We're, at the peak there, we were about 10 times this, so that's come down really well. We're averaging between 4 and 5 deaths a day. That is also falling. You can see just last week we were between 8 and 9 a day. Most of the hospitalizations and deaths continue to be in folks who are unvaccinated, so continue to really promote vaccination. We've been seeing some of that fall off, but reminder, this is, every day there are still thousands of folks getting vaccinated, including for the first time. And testing remains high. If you see this, we're at 25,000 tests per day on average. And just for some comparison here, if you look back to last summer, which is the last time we were down kind of under even 200 cases a day, we were doing quite a bit less than half that, right? You see this? We were averaging 8,000, 9,000, 7,000, 6,000 tests per day. Obviously, saw that go up as COVID was increasing, which isn't a surprise, schools back in session, et cetera. But at the peak here, we were doing as many as 60,000 tests in a given day. But here at about 25,000 a day, that's still very, very high. See this? Higher than we were at any point during last year's surge, certainly higher than we were the whole first year of COVID. And these are only the reported tests, right? This doesn't include, over the last couple months in particular, we've seen a big increase in the availability and the use of the at-home tests. And that's one of the reasons why I expect, looking ahead, CDC will be depending a little bit less on things like positivity or test numbers. We'll be wanting to put that in some larger context, looking at the outcomes like hospitalizations, some of the things that are less affected by changes in testing. And then our positivity rate, very low at 1.4%, down from 1.9 a week ago. Again, you can see last time we were that low, was months and months ago, and very pleased to continue to see that progress. And it is in that setting that we're able to move ahead on Monday. So let me pull up a couple of slides here. So first, when we put that data onto the risk matrix, just as a reminder, you can find the risk matrix every day right at the top of the dashboard. It's the second pull down after dashboard, but here it is. You see that our cases diagnosed per day remain in the substantial transmission category as it's been defined sort of all along. We said we weren't going to change anything as we came off of Omicron, but we needed 3 of the 4 metrics to be down in lower or low transmission. And this is kind of what I expected to happen, where we saw the positivity get all the way down into green here, low transmission, less than 2%, because we are just testing catching so much more. There are fewer cases that you're missing, and so your case rates are relatively higher than they were without the risk being substantially higher. And I've got the CDC matrix to actually talk about that a little more in just a second, because a number of you had questions about it. But seeing this come down, where I think about these two kind of balancing each other out. If this one's in green and this one's in yellow, it's similar to in the past, they would have both been in blue. And then hospital and ICU, this is what we really wanted to make sure would get into lower transmission. And so you can see we're currently averaging 229 in terms of hospital beds filled with COVID patients in the hospitals across Chicago, 75 in the ICU on average with COVID in the hospitals across Chicago. And I did want to be clear, this is the 7-day average. So this reflects what has the average been over the last 7 days. So once we see this sort of drop into a range, you know you've been there for the last week. So if you looked up today's number, it would be lower because we continue to see it drop. But we report out the 7-day average, partly because we can see variations, sometimes quite a bit of variations day to day from related to timing of hospitals reporting or sometimes acute changes in given hospitals, and but it does reflect sort of over that last week. So to put this in some context, our highest daily case count in the whole pandemic, not just Omicron surge, by far, was on December 28, where we had more than 10,000 cases reported just in the city of Chicago. So to go from 10,000 down to now 270 is really, really good progress. This exponential growth we saw on this side was followed by exponential decay coming down off the curve. And that's what we'd seen in South Africa with Omicron, but weren't sure early on that we would see that same kind of decline here. Very pleased that we have. But that's really amazing progress. Similarly, our test positivity peaked January 1st at 20.3%. Whenever you've got a positivity of 20%, reminder, what does that mean? 1 in 5 tests that are being done in the formal lab system are coming back positive. I think of positivity mostly about how much are you missing? Are you doing enough testing? When you're at 20% positivity, you know there is a lot of COVID out there that you're not catching. When you're at a test positivity of 1%, you're testing a ton. And you know that your case count is not a major undercount. Hospitalizations similarly peaked January 4th was when we had the most, 298 Chicagoans hospitalized newly that day for COVID, and we're now at 10% of that, even lower, just 22. So still not nothing, still above where we were last summer, but this really, especially knowing that the great majority of that surge was in folks who were not vaccinated, feeling confident about our hospital capacity at the moment. And then our hospital census, meaning how many people are in the hospital. We peaked during Omicron here, the most people with COVID in the hospital in Chicago than at any prior point. So if you look back to the beginning of the pandemic, the very beginning of the surge, we peaked out here around maybe 1,200, 1,300 in the hospital. And we knew a lot less about COVID at that point, but it was the setting in which we were testing, anybody who's coming into the hospital, anybody who's dying. So in a lot of ways, this hospital comparison is a better one over time because cases didn't look as high early here because so many fewer people were getting tested. People coming to the emergency department, getting hospitalized, dying, that is sort of a better comparison, if you will, over time. And so this is a big deal to have seen the most admissions at this point. But what was different compared to the 2 prior big surges was that this time, luckily, vaccines were in place and were the most important thing in terms of not making this worse. Our daily average at 229 does mean we have 19% capacity available across the system for non-ICU. That's very good. Similarly, our ICU is very good. We peaked at 330 for COVID, currently at 75 with COVID, and there is 17% capacity across the ICUs. Again, that is fine at this point. All right, some of you were asking about the CDC risk table, and I thought I'd put it in here just to show you a little bit about kind of how things have continued to change. I do think CDC is likely to be doing some updates to this, probably relatively soon, because a number of things have changed. When this risk table was put together, it was the fall, I think September of 2020, long before vaccines are available, and at a point when testing was much, much, much less available than it is now, a year and a half later. And so when previously, if you kind of get a sense of this, so let me just put it in some context for you. So new cases per 100,000 persons in the past 7 days. High means you've had more than 100 per 100,000 over 7 days. For us here in Chicago with our population, that's what works out to approximately 400 cases per day, right? That's the number that we've used all along. Similarly, when you go to 50 per 100,000 in the past 7 days, that's about 200 cases here. So that's why Chicago had actually developed its metrics before CDC came out with theirs, but luckily when they came out, they were quite similar to what we had used and we didn't have to adjust. And so that's where, high risk all along had been considered that over 400 and the moderate or substantial had been the substantial rather had been over for us 200 cases and then under that. But the thing I want to just point out is how different the positivity was, right? At that point, if you look at the percentage of positive tests during the past 7 days, you were considered low risk if you were under 5%, moderate at 5 to 8, substantial at 8 to 10, and then high over 10. Well, we haven't been over 10% except for during this Omicron surge in, months and months and months and months and months. And in fact, we already, we were at a point where we were seeing high in terms of cases and low in terms of positivity, which has only gotten worse. You are meant, per CDC, to use the higher transmission level, but I do think CDC, particularly as we said here, we're going to use the what we've been using all along. We got to see 3 of the 4 hit it. But I think moving forward, as CDC makes some adjustments, I want to preview that I think things like test positivity are not likely to be a major part of what we follow going forward. I think we certainly will continue to follow cases, as well as, those of you who watched when we talked about how we do influenza surveillance. I think that's how we'll be doing it. We'll be looking at the percentage of folks who are coming into emergency departments who test positive for COVID or have COVID-like symptoms, both probably. We'll be taking some samples and collecting what's going on in outpatient settings and inpatient settings. We will continue to count severe outcomes, things like hospitalizations, ICUs, deaths in terms of complete numbers there. But we've never counted every case. We've always had to do, when we're doing risk assessments, and maybe I'll show that in a minute because I know we got some questions about that too. How do we actually do some of those assessments of what is the risk in a public place? But this is what CDC was using for the last year and a half, and I think they, just like we, as we come off Omicron and think about what it looks like for this to be endemic, are likely to be making some adjustments, and I think that is absolutely appropriate and in line with the science. You want to be able to predict if you're going to be in a surge, if that surge is going to result in bad outcomes, and in a highly vaccinated setting, that risk is just different than it was before vaccines. The vaccines luckily do work. As we showed you, you can get all of this off the dashboard now up at the top under other data. Again, this is just comparing in red unvaccinated Chicagoans, light blue vaccinated Chicagoans, and dark blue boosted Chicagoans. And we are running automatically that just during the past 4 weeks is how this is set up. Unvaccinated folks had a 2.5 times higher risk of testing positive for COVID compared to people who were boosted. And it was greater than that. You can see the difference between blue and red was even greater than that at the peak of Omicron. But even if we just look since late January, although those are getting closer together, still, 2 to 3 times as likely. And then just during the past 4 weeks, folks who are unvaccinated more than 6 times as likely to be hospitalized compared to folks who are boosted, and then deaths about 13 times. So again, I'm very careful. I never want to blame folks who have not gotten vaccinated. I want to make sure we're having conversations about it. I really enjoy talking to people who have not made that decision because I'm interested in why they're making that decision, but I do worry a whole lot about them when I hear people who are not up to date with vaccination getting COVID. I worry in a different way that they could get seriously ill, hospitalized, et cetera. And for me, at the population level, obviously for Chicago, where I'm worried about overwhelming our health system, if we go back, I mean, look at how small that increase is in the blue there for hospitalizations. It's not nobody, and I recognize, you know, where folks are immunocompromised, where folks have a lot of underlying conditions. I'm not saying there's no chance that you can end up in the hospital. You can for sure, and you know, if somebody does end up in the hospital, I'm like, thank goodness they're vaccinated or boosted, because there's a good chance they would have died otherwise, honestly. But we can tolerate increases sort of at a societal level of hospitalizations in folks who are vaccinated and boosted, if it looks especially like that boosted, that bottom one, in a way that we can't tolerate that red that fills up hospitals, makes us have to cancel procedures, makes it people have to wait for care, has a lot of indirect effects. And so it's one of the reasons we continue to push vaccination so hard. Just as a fact, 7,488 Chicago residents have died as a direct result of COVID-19 infection. Almost 900 of them, 889, just since January 1, 2022. We're not even 2 months into the year. And in comparison, 0 Chicago residents have died as a direct result of COVID-19 vaccination. I continue to see a lot of misinformation being spread on social media, so I sometimes like to just compare those. We are in touch, you know, that the medical examiner agrees, et cetera, and really would encourage you to share that information if you've got folks still trying to say there's, you know, millions of people dying from COVID vaccination. It is simply not true. The number is 0 here in Chicago. We hit this exciting benchmark where more than half of our 5 to 11-year-old Chicagoans have gotten at least a first dose of the COVID-19 vaccine. Child there is wearing one of the capes that we give out at our city vaccination clinics on Saturdays and Sundays with the Vax Hero, and it's I've been to those a number of times now, and it's really nice to see the energy. They're obviously open to adults and kids, and we do boosters, but I'm seeing a lot of kids get vaccinated there. And if we look specifically at that, we're actually at 51% now, just about, of the 5 to 11-year-olds, and 80% of the 12 to 17-year-olds have gotten a first dose of COVID vaccine, well above the national average. Across the country, just 32% of 5 to 11-year-olds and 67% of 12 to 17-year-olds have had that first dose. Obviously, in terms of fully vaccinated, still a little bit behind there, but that always lags by a few weeks by definition. So making good progress, but there certainly are some settings that are less vaccinated. There's a big range, for example, in terms of how vaccinated different schools are. We saw this good increase. Some of you had asked questions about what's happening with the indoor vaccination requirement, and I did just want to point this out. This is off the dashboard, but you can see that the red and the dark blue here are 18 to 29-year-olds, and you see how as we move into January, those increase really quite a bit compared to what the other colors, what the other ages were doing. And just to kind of put some numbers on that, just to give you a sense of this. So if you look and say the first half of December, where we were already, you know, seeing the Omicron surge, we were seeing vaccinations increase, we were seeing about 150 12 to 17-year-olds get their first dose, and about 550 18 to 29-year-olds getting their first dose of vaccine each day. And then in comparison, if you look in the first part of January, we saw that go up 2 to 3 times, where we went from about 150 12 to 17-year-olds a day to about 350 12 to 17-year-olds a day getting their first dose of vaccine. And in the 18 to 29-year-olds, we saw it go from about 550 a day to about 1,000 a day. Similarly, in that, say you take the first 2 weeks of January, we saw about a 1% increase, 1.1% increase in coverage overall in the 12 to 17-year-olds, and then in the 2-week period in the beginning of January, a 3% increase, so about 3 times really. And when we were surveying folks, it's not a full survey across the city, but people who come to get vaccinated at city clinics, we asked them what made them decide, especially people getting a first dose of vaccine, what made them decide to get vaccinated now. And about a third of folks at our clinics were saying that the vaccine requirement for indoor high-risk places was at least part of that decision. So not the main reason we did it. The main reason we did it is unvaccinated people end up in the hospital, our hospitals are filling up, but we did see some impact with that. Similarly, making progress here. As we announced, a Latinx Chicagoan just as likely to have received at least one dose of COVID vaccine as a white non-Latinx Chicagoan, which is great. 61% of black non-Latinx Chicagoans now had a first dose. Still a ways to go there. And Asian non-Latinx Chicagoans, most vaccinated in Chicago, with 84% having had a first dose. You see here, just over the last month or so, that Latinx line in blue come up to meet the line for white Chicagoans at 75%. And I also just wanted to point out that we actually, like among black Chicagoans, for example, you see that purple line, it has never stopped growing, right? Week after week after week after week after week after week, we see black Chicagoans keep getting vaccinated. And to an extent, you see that across all of the race ethnicities. But the increase, you see that bump in, when you see sort of more of a bump across all of them, that's when another group, like that bump around, in the late fall there, that's around when the kids were eligible. But otherwise, things have been relatively more flat for white and Asian Chicagoans, but they've continued to increase nicely for black and Latinx Chicagoans. I'd love to be in a point where we're seeing black Chicagoans also as vaccinated as white Chicagoans, and I'd love to see all three groups as vaccinated as Asian Chicagoans. But thanks to everybody who continues to work on this, and I know some of you are like, nobody's still getting vaccinated. They are. Every day they are. And every day there's people making the decision to do it today. It is our final weekend of family vaccine clinics. That's the big, larger sites. Saturday we're at Truman College. Sunday we're at Malcolm X College, 9 to 2. You can sign up, chi.gov/COVIDvax, register in advance. You can also just walk in. And our at-home program is not going anywhere. So everybody can continue to get a vaccine at home free of charge. We'll do pediatric, adult, and booster Pfizer doses. We'll do up to 10 folks at one time. There is the $50 incentive in place for people getting a first or second dose. And we've got appointments Monday through Sunday, 8 a.m. to 6:30. As always, schedule your appointment, 312-746-4835. Just another reminder, we've been saying this each time, but there are early treatments available for COVID. If you're over 65 or you know somebody who has an underlying condition, you're worried about them, if they test positive for COVID, even on a home test, please call your doctor, call your provider, because your doctor might want to, or your provider might want to recommend one of the early treatments. There's oral ones, there's IV ones, can help keep you out of the hospital, but they're only good if you take them early. They help keep the virus from copying. And that's true regardless of your vaccination status. As always, you can give us a call at this number or go to our website with questions. And then the last thing before we get into more of your questions, I took a little longer on this because I wanted to address some of the things coming in a lot, is that today there's actually a new song being released. Keith Harris and BJ the Chicago Kid, who is a Grammy Award-winning producer. Keith Harris is the producer, and then BJ the Chicago Kid is a Grammy Award-winning singer. He's the lead. There's a chorus of kind of Chicago's vaccinated teens. It's on YouTube, but I think if the team's able to bring it up, maybe we'll show you the music video. It's just a few minutes long, and then we'll come back and get your comments and questions.
Yeah, y'all ready? Yeah. Oh, let's get it.
I decided to get vaccinated because I wanted to protect myself and my family.
My grandmother recently got diagnosed with cancer during COVID, so I wanted to make sure that I was protected, to make sure that she was safe.
First, take care of yourself, and second, think about others.
If you're with me, we'll never blow away when times get rough, 'cause when you fall down, I'll still be right here. Are you with me? Do you feel the soul of every street? Listen real close to the sounds of the city. And now I'm stronger than who I was before. I know what I'm standing for. Yeah, I'm one of one, with a dream that I believe can start with everyone. All it takes is us. Yeah, I'm one of one, and the future that I see is brighter than the sun.
a shot, we unify, there's nothing we can't achieve. Ain't an I and we, but there's an I and believe. Community's all we got, matter of fact, it's the key. The city should never fade unless it's by 2 or 3. Your faces I wanna see, places you wanna go, so let your light beam. I want them to see you glow. From the south side, outside, west side, let's ride. We in this together, no more standing on the sideline.
Stronger, stronger than who I was before. I know what I'm standing for. Yeah, I'm one of one, with a dream that I believe can start with everyone. All it takes is us.
The vaccine changed my life because I feel safer with it.
Now I can worry a lot less.
It's best to take the COVID vaccine than to not take it.
I'm one of one. I'm one of one. I'm one of one.
Yeah.
I'm one of one.
One thing about the shy, the people, they got pride. Whenever they get the call, you know that they gon' ride. I'ma do it for you, you gon' do it for I. Let the hawk blow away all the fear we got inside, and all the anxiety, the pain, sorrow. Unify the people, we can change tomorrow. Community is unity for sure. Y'all know we better when together, truly yours. Chicago.
Ooh, for my soldiers, they died so we can be free now. Can I get a ooh? No, the ops couldn't hold me down. We in the streets with our hearts held high. We are alive. Yeah. The dream that I believe can start with everyone. All it takes is us.
If I could change the future,
I just wanted to be peaceful.
There wouldn't be any countries conflicting with each other.
No poverty.
The animals live free.
No more global warming.
There was less crime.
No more racism.
Everybody's treated the same.
Yeah.
I'm Elise, and I'm one of one.
I am Milan, and I'm one of one.
my name is Diego, and I'm one of one.
And now I'm stronger, stronger. I'm one of one. I'm one of one. And now I'm stronger, stronger. I'm one of one. I'm one of one.
And that's it.
All right, great, thanks. So I hope you liked that. I thought it was really nice, very positive, kind of a love letter to Chicago. So thanks to everybody who helped make it, and especially to the teens in the chorus. And anyway, thanks for taking the time. So let's get into your questions. We've got a few questions about gyms and fitness centers coming in. So I've got Kristen Korkowski on Facebook saying, with the mask mandates dropping, do you think it will be safe to be in a dance aerobics class without a mask? We're adequately spaced out, about 2 arms lengths between me and the next person. That's our old spacing, that's right. Good ventilation system and several fans going. Eager to get back to working out constantly. We've also got Coops on Twitter saying, I go to the gym every day in a KF94. Now everyone will be unmasked. Some have already been that way. I try to stay away from people, but it's pretty impossible. The gym is really well ventilated. Will I be safe? So to both of you, I would say the reason that we are, and this is, I took these together because they were both about gyms, but they're about recognizing that when we make the recommendation to lift the mask requirement, it's primarily based on how likely is it that you are going to come into contact with someone in Chicago when you are just out and about and you're not in full control of, exactly who is in your home or who's in setting with you. How likely is it that there are folks with COVID who may not know it? And as COVID comes under better control, that risk really goes down. So I'm going to show you in a second, I think, maybe one of the public-facing ways that you can look at some of these risk analyses, because I think it's helpful. But broadly to both of you, I would say, yes, I think it is fine at this point to go to the gym without a mask. I think, Coops, to your point, you've been wearing a KFN94 and going to the gym, and as you know, that does bring some added protection to you. And if you are able to work out with the mask and you feel feel more comfortable doing that, of course, I encourage you, to continue doing that. It will give you some extra protection if it gives you peace of mind. But it is absolutely not sort of required. And I think, Kristen, to you, can you do the dance aerobics? When both of you mentioned ventilation, which I was happy to see, settings that are more ventilated, more vaccinated, more spaced are all going to be safer overall. And then the other thing is that, of course, working out is something that overall is good for your cardiovascular system, right? Good for your immune system, et cetera. So yes, I know people are excited about being able to be back in the gym without a mask, and I do think that is safe. Is the risk zero? No. Is the risk ever zero? No. But overall, I think it is fine for you to Coops, for you to go and keep wearing your KFN94 to give you extra protection if you're comfortable with that. I'm in full support of that. And Kristen, if you're feeling comfortable taking it off, in either way, folks around you, I think the risk is low, and that's why we're doing it. Christine O'Hara from Facebook. How accurate can the COVID numbers be if people can test positive at home with a rapid test? Yeah. So this is kind of what I was talking about a little bit with, as the whole testing landscape has really changed, we have seen the numbers of reported positive tests and that positivity be different at different points. Where you have very little testing going on, your number of cases by definition will be lower, but your positivity will be higher. We're also testing a lot more asymptomatic people in schools, for example. That's a different sort of what we call how likely is it that the test is going to be positive. That's going to be a whole lot lower if you're testing a lot of asymptomatic people who you don't think have COVID versus folks who are coming in with symptoms. So we always make estimates that behind the scenes we're using to say how much are we missing of COVID, and to address a number of these questions about how do I assess my risk, and even Christine, to your question, why don't we actually take a second? I'll show you one of these public-facing kind of COVID-19 risk planners. So can we pull up this? Can we pull this up on the website? Let me know if it's up or not. It's up. Okay, great. So this one, you can see it's covid19risk.biosci.gatech.edu. It's Georgia Tech. It's basically COVID risk estimates by county, and if you take a look at the bottom, this is a risk assessment planning tool. It started at Georgia Tech way back at the beginning. It's had a lot of different folks be involved, Applied Bioinformatics Laboratory, Duke, Stanford. It's based on CDC data, et cetera. You can read about it. I like it because it's pretty easy for the public to use, and it lets you kind of look at the whole country and get a sense at a county by county level, updated each day, on what the risk might be. So let me show you kind of how you can use this. So when you log in here, first, what does this mean? This map shows the risk level of attending an event, given the event size and location. The risk level is the estimated chance between 0 and 100% that at least one COVID-19 positive individual will be present at an event in the county, given the size of the event. So this means that if you have, and then, you can choose an event size. Here it's set at 25, and then ascertainment bias, which we'll talk about in a second. So at an event with 25 people, like, for example, 25 people, a classroom, a small bar, et cetera, what is the chance that at least one person in that classroom, in that bar, will have COVID-19? There's assumptions that obviously this risk is universally across, and et cetera. But then you reduce the risk that one case becomes many. If you wear a mask, you get tested, you get vaccinated, you distance, you meet outside, you increase ventilation. So we're not saying that one case means there will be spread, but it means that there's folks out there. And so particularly where we're thinking at the societal level, when are you at a place where you can drop masks? You want to see that risk be low enough. And so let's talk about ascertainment bias for just a second. So ascertainment bias is the fancy word for what we do behind the scenes in epidemiology for how much are we missing in the formal numbers of COVID cases. So you can see here, you can set your ascertainment bias at 3, 4, or 5. 3 means there is probably 3 times the amount of COVID than what is being formally tested and reported in the laboratory system. That would include folks doing a home test. That would include folks who are asymptomatic and never get a test. And depending on your testing level, sort of in different parts of the country, really the estimate is you'd be between 3, 4, and 5 on that right now. I will tell you, early in COVID, the estimates here for ascertainment bias were more like 5 to 10, where we were estimating there were probably 5 to 10 times as many people with COVID as were being formally reported in numbers. It doesn't mean the numbers are not true. It doesn't mean that it doesn't affect risk in the same way. But when we're trying to do these estimates of gathering sizes and where it can look, what the risk would be, you do have to make some assumptions there. So let's look at this. So if we have it set for 25 with an ascertainment bias of 3 would mean we have pretty good testing, which I think we do here. So if I set it for the lowest ascertainment bias, you can literally hover over the county. So let's hover, and here's Cook County. The current risk level is 12%. The immunity via vaccination is 70%, meaning fully vaccinated. And at 12%, remember, what does that mean? There's about a 12% chance, a 1 in 10 chance, that if you have 25 people getting together, randomly selected from across the city, about a 1 in 10 chance that one of those folks could have COVID. And when you get down to a risk level like that, that is a low risk setting. It's a setting where you can be lifting mask requirements, et cetera. If you look right now, for example, Maine is really having a bit of a surge right now. And if you hover there, at the same gathering size in this county in Maine, it's about an 80% chance that in a gathering of 25, you're going to have somebody, who has COVID right now. And so you can, you can hover and explore. So you can say, let's set it here. Sorry, it just timed out for a second, but there you go. You can set it for here, you can just move this. You can say, okay, in a 100-person gathering, what would it look like? And you see here that actually, you can zoom in and out, that Cook County here is the lightest of the whole state in terms of that risk. So even in a 100-person gathering, now down to less than a 1 in 2 chance that there could be somebody there who statistically has COVID, and we've got the high vaccination rate. So this is the kind of thing that we do. And so for you, if you are thinking about traveling, if you are thinking about getting together, especially I understand folks who have underlying conditions or children under 5 who haven't been old enough to be vaccinated, et cetera, this is the kind of tool you can use. Again, you can set, and you'll see how it changes as you set the ascertainment biases, but 3 would be the most conservative, and that's what I would suggest using because we do a lot of testing here. But either way, it doesn't change a ton. But you can say, all right, I'm getting together with, 10 people, and here in Cook County right now, that risk is 5%, very, very low, that even one of those 10 people could have COVID. Whereas if you're going to go to a, 5,000 person gathering, the whole country just about is 100%. Somebody is going to have COVID if 1,000 people get together. It doesn't mean someone's going to spread it necessarily, but again, that's what's there. So anyway, I just wanted to share this with you because I think it's a public-facing sort of nice way for some of you as you're going to be making some of your own decisions about traveling and COVID risk and how careful one needs to be. This can be a nice tool, I think, for folks to use. So, all right, we can take that back off the showing. Thank you. Okay. Here's a question. Megan on Facebook says, I have a friend who is actively trying to become pregnant. Should she continue wearing a mask in public? Is pregnancy a high risk? So I think this points to, as we lift the mask requirement for everybody, first of all, a lot of people are going to keep wearing masks, and that is absolutely fine. I am never going to recommend that somebody take a mask off if they're more comfortable having one on. And there are people who, again, have certain reasons. Maybe if they are themselves not immunocompromised or too young to get vaccinated, they may have somebody at home or somebody in their close circle who is at higher risk or unvaccinated, and they're wanting to be extra careful. Not a problem. I also think, in this case, pregnancy is a high risk for bad COVID outcomes. It's why we promote vaccination so heavily for pregnant women, because your immune system changes when you're pregnant so that you don't sort of reject the fetus. And it means that women can get much more seriously ill, not just with COVID, but with other infectious diseases if they get sick. It's why we see pregnant women every year get really sick from influenza, et cetera. And so it's especially important that women who are pregnant be up to date with vaccination. The other thing is that pregnant women, babies, when they're born, their immune systems are not doing much of anything for that next 6 months. They're really for the first 6 months. They're really using the passive immunity that they've gotten from their mom in the first 6 months. It's why many vaccinations, don't start until kids are even a year old, depending on exactly what we're vaccinating against. But for that first 6 months, for things like influenza or for COVID, any protection that the baby has is based on the antibodies the mom has. And so if the mom has been vaccinated against COVID before the baby's born, some of that immunity transfers to the baby and it gives some additional protection. But in terms of back to your friend here who's actively trying to become pregnant, trying to become pregnant is not a higher risk status, but if she is more comfortable wearing a mask, she absolutely should wear a mask. And if she became pregnant, then the risk would be higher if she were to get COVID. Again, the risk of just being out and about is low at this point. That's sort of, one of the reasons I'm showing and talking a little bit more about how we assess this. I do think it's appropriate. You want to make sure that people who are pregnant or wanting to become pregnant are healthy and are getting their exercise and eating well and sort of doing all of those things. So I hope that helps kind of answer the question. I can't make the individual decision, not just for this, but in all of the situations. You're going to be weighing sort of the risks and the benefits. But I'd say, if in doubt, plus it's cold out right now. And when it's cold out, I see a lot of people wearing their masks like they would wear scarves. I ask people, please, as this lifts, to be kind to each other. Our enemy is the virus. It is not each other. And I am very confident that we are in a place to be able to lift the requirements. But I know that makes a lot of folks nervous, and that there are settings that will continue to keep them in place. And I want to be clear that that is absolutely appropriate and okay. It's different when the health department basically says there's enough risk at the public level, we're having this big surge, we're threatening the hospitals, et cetera, et cetera. When we have that requirement in place, it's for full, public health protection across the city. However, we know that there are plenty of settings that have been wearing masks or requiring vaccines all along, and if they choose to continue doing that, we of course are in full support of that. If there are, story hours for children under 5, of course you want to wear masks at that. That's a good move. If there's, senior gatherings with high-risk folks and there's decisions to wear masks, yes, of course, that's fine to do. Where there are arts or theater and they're deciding, we want to make sure our patrons are feeling comfortable, and we've been seeing, good uptake, and keep that in place. Of course, folks are encouraged and willing to do that. So it's going to be a little bit of a time of flux. I know that there are a number of settings that are watching to kind of see what happens over these next few weeks. We may see a little bit of a resurgence. We don't, whenever there are changes in mitigation, you can see a little bit of an increase. One of the most important reasons to wait, to be at a point where you've seen that good exponential decline, you've seen it sort of continue to be like that graph shows. You want to be making that move at a point where you're confident that you're not going to sort of see a significant resurgence. It's one of the reasons you have to wait to hit some of those metrics, particularly where we get to the more severe outcomes in the hospital capacity. But we are in good shape at this point. Isaac on Facebook: should people still quarantine if they've been exposed to someone with COVID? If so, for how long? So let's talk for just a second about maybe isolation and quarantine to make sure folks understand. So isolation means if you have been infected, you are sick with COVID, that means you isolate. That's the public health term for it. Yes, if you are diagnosed with COVID, it doesn't matter who you are, it doesn't matter what your vaccination status is, you need to isolate at home a minimum of 5 days, and then days 6 through 10, if you're feeling better, your fever's gone, et cetera, you could come out from your house, but for days 6 through 10, you need to continue to wear a mask in public settings. That doesn't go anywhere. So that's another thing. We'll see people wearing that mask even as the mask requirement is lifted for everybody because they're doing the responsible thing. They're just post-COVID, et cetera. For quarantine is the term we use in public health, not for I've been infected, but I've had a very close exposure to someone who has been infected. And related to quarantine, the big question there is, are you up to date with your vaccinations? For adults, are you vaccinated and boosted? You know, for the kids, are you fully vaccinated, not yet due for a booster? And if you are fully up to date with your vaccinations, you don't need to quarantine, even if you've had a close exposure. We know that risk is lower, it's not zero, but as long as you don't develop symptoms, et cetera, you don't need to. It's one of the most important reasons for kids to get vaccinated, because then if there is a case of COVID in their school classroom, they don't have to quarantine unless they develop symptoms. It helps keep kids in school, have less educational disruption. However, if somebody is not vaccinated, not up to date with their vaccination, and they have a close contact, yes, they need to continue to quarantine. It's the same as isolation. For 5 days, you got to stay home. If you're still feeling good at that point, days 6 through 10, out, but with the mask, days 6 through 10. Isolation and quarantine is not going anywhere, at least in the short term. They remain important, just because we're lifting sort of the public mask requirement does not mean that we are lifting the isolation and quarantine. We'll continue to follow the data. As you know, we were able to shorten that isolation and quarantine period based on what we saw, you know, how we saw Omicron moving so much faster, et cetera. Particularly in educational settings, we want to do everything we can to limit disruptions there, and we want to keep schools open. So that's what I would say there. Dan Smith on Facebook, what is the latest data on the need for a 4th shot in the future? Oh, and he puts, oh, thanks. He says, by the way, you're the best. The city is so lucky to have you. Thank you. I get a lot of nasty comments, so it's nice to see some nice ones. But to your question, so the data is actually looking good at this point related to what is this looking like in terms of long-term need for additional and repeated COVID boosters? First, let me start, as always, by saying I can't always predict the future. I don't know for sure what this is going to look like. But what I can say, on Tuesday, I showed just very briefly a couple of the more recent studies that have come out. There were 2 published in Nature, which is one of the biggest, sort of best science publications in the world. A couple other high-profile studies just in these last few weeks that have shown really nice levels of protection, both an increase in antibodies well above antibodies, you know, this is what your body makes to help fight off the COVID infection. Really nice increase after that 3rd dose, quite a bit higher than either the 1st or 2nd had been. And secondly, that we're seeing very nice activation of some of the other parts of the immune system, which are harder to study. The T cells, the B cells, those are not your immediate line of defense, but they're what kind of come to the rescue if you do get infected. So this is one of the reasons why we saw so many people in Omicron get infected, but not necessarily get as seriously ill, not end up in the hospital, because Omicron was so infectious, so contagious, and it is so infectious and contagious that someone can get infected, particularly in their nose. If your antibody levels are not that high with something that contagious, you sometimes are able to get infected, right? And especially if we're swabbing in the nose, you're gonna pick it up. But for the virus to kind of get deeper into your body, to get into your lungs, to start causing, you know, the respiratory failure, et cetera, especially in somebody who's not immunocompromised, the antibodies are not the end of the story in terms of your protection. Your B cells are a part of your immune system that are there and can kind of churn out additional antibodies. And your B cells have continued to evolve to kind of get smarter, to make the antibodies that you would need. Your T cells can come and actually kill infected cells if they did get infected with COVID, and otherwise sort of fight it. And so we saw this difference where people would get infected, but the rest of their immune system would kick in because of their prior vaccination for the most part, and they were unlikely to get as seriously ill. And that response seems like it's really quite long-lasting. They've gone back and looked at people who were infected with SARS, if you remember, this isn't our first coronavirus big recent outbreak. SARS back in 2003. There are folks who were exposed to SARS, able to develop antibodies. There was work on vaccine. The thing calmed down. And even, 18 years later, their T cells are still kind of have that lesson in them. So that's a good sign. At this point, I do not think it is likely that there will be a fourth dose recommended anytime soon. Let's say that. Again, if there are people who are immunocompromised, I'm leaving you aside because there are some separate recommendations there. It's not that they need to keep doing things, but sometimes they don't get as much of an immune response. So talk to your doctor if you're moderately or severely immunocompromised. But for everybody else, really it looks like the combination of that initial vaccine plus the booster seems to sort of be enough for the moment. And some of the studies that I showed also were really reassuring that without having created a new version of the vaccine for Omicron, the way that the B cells in particular were able to adjust, and there's something called the germinal centers that make the new antibodies, they were able to continue to fight off the Omicron variant, even though there had been a lot of mutations, even in the spike protein. So it gives us confidence that the vaccines are doing what they need to do in terms of you learning that long-term lesson. Might there be another sort of quote-unquote booster? There might be. Might we be in a point where it even becomes a yearly recommendation like the flu? It's possible. For influenza, as a reminder, there are so many variants, or we call them strains, but they're like variants, more or less, that every year, that's one of the reasons we never can completely get on top of influenza either, is because it changes so much. And so every year we take samples of influenza and we see what the strains are, what the variants are. And every single year the scientists make a new version of the flu vaccine to fight off the strains that were the most prevalent in the other hemisphere's winter, if you know what I mean. So we look at the southern hemisphere to see what strains of flu were circulating in their winter to make our winter's flu vaccine, and vice versa. So if this settles into more of a seasonal pattern and we start thinking of a COVID, and flu, kind of a respiratory virus season, might we be at a point down the line where we're making sort of an annual version? We might. But I don't think we'll see a fourth dose. My guess is I don't think we'll see a fourth dose recommendation, certainly anytime probably before the fall or winter. We may not even then. Of course, the big question is what happens if we get a new variant? What if we get a variant of high consequence when the vaccines really are not doing the job like they have been? They've been performing absolutely amazingly, especially in terms of protecting people against severe illness. But if we don't see that emerge, I don't think there will be major need for another booster soon. And we'll keep you up to date. So please do come up to date. We'll keep you up to date, but please come up to date in your vaccination. Get that booster if you haven't. It clearly seems to complete that lesson for your immune system, both on the antibody side and on the B and T cell side. Okay, so a couple of just questions here about sort of law and executive orders and vaccine mandates and mask mandates and the city's home rule authority. So let me just address kind of very high level here. So first of all, let me be clear, I am not a lawyer, but we talk to our law department a lot. And first of all, the city absolutely, just like every other jurisdiction, is able to put orders in place that are stricter than the state. We are not allowed to be less strict than the state. That's how it works. And so, for example, if the state has a mask requirement universally in place, the city must have a mask requirement universally in place. If the state lifted its order, the city could continue to have it. And that's not just the city. That's true across the state. And one of the decisions we were really looking at was, were we going to hit our metrics in time? I was very much hoping to be at a point where we could go along with the timing that the state had put forward for the 28th. When we hit that third one, moving into the lower risk on the 21st of February on Monday, I was like, yes, because that meant we'd been in it, for the last week, and then we were a week to the 28th. Even if we were within a few days, we would have gone along with the 28th, just because I know it can be confusing to people. But But nevertheless, just so you understand, in terms of home rule authority, et cetera, we can be more strict. We just cannot be less strict. And then in addition, there's a question here about the judge's ruling sort of downstate about Pritzker's order for mask mandates. How does that affect the city? So let me just be clear that, again, there's a lot going on in the legal front. Not a lawyer, but what happened is there was a lawsuit brought about one of the executive orders at the state level, specifically about masking in school settings. And there continues to be back and forth. I think it's at the Supreme Court there now, et cetera. That in no way impacts the city of Chicago's order. So yes, we are lifting that order on Monday, the 28th, and at that point, there is not a city requirement for masking in indoor public settings, but that has nothing to do with what is happening with the with the ongoing back and forth with the judge at the state. And finally, I'm seeing a few questions here about schools. I see Melissa Douglas on Facebook. Are non-CPS schools able to drop masks after 2/28? Christy Van Ryan is asking, why can Catholic school students remove their masks, but CPS kids can't? So let me just address this high level. As of the 28th, there is no longer a city of Chicago requirement that in all public settings, masks needs to be worn. There are certain settings, as you heard me say, that may make decisions to continue to have masking. The things I am interested in, my first question about that is, is this a particularly high risk setting? A school is not particularly high risk, but if we're talking about, say, a school that has a lot of kids under 5 who are not eligible for vaccine, or a preschool, there are different situations there. But the other thing is, how vaccinated is that setting? And so if we've got a setting that is like, a school that's 80% vaccinated, or a school system that's at least 75% vaccinated, that's not a setting I have a lot of concern about potentially taking off masks. If you've got a school that's 20% vaccinated, though, that is a setting that is much more likely to have problems with COVID. And so I know CPS does not intend to keep masks forever, just like nobody intends to keep masks forever. I am in full support of their decision to keep the masks at the moment, and I know that they're having conversations about what that's going to look like to carefully be pulling some of that back, but in a way that's based on the data and based on the risk. And it is true that there are, that students in CPS in many of the schools, those are less vaccinated settings than in a lot of other settings, and so. I know that the Archdiocese has made a decision to move to sort of a mask optional as of the 28th, and they are within their legal right to do that. I know those are highly vaccinated settings also, and we've been talking to a lot of schools behind the scenes. Different school districts, et cetera, are making their decisions there, and we're advising. But just like for you, when you're making decisions out in the world, I would expect to see some individuals in schools continue to mask, but also some of those decisions be on how vaccinated is the setting, do you have ventilation in place, what are the other mitigation measures, et cetera. I don't want to sort of speak for all schools, because I know that different schools are going about this, wanting to make sure they're getting their community input. There's a lot of variation in terms of how people feel about masking in schools. We've got to make sure that you're at a point where there are kids, who are, or adults who are, have problems with the immune system, too young to be vaccinated. We're sort of balancing that with, overall. Everybody's top goal is to keep schools open and to do that in as least restrictive a way as we can without unnecessarily increasing COVID risks. So it's a good moment. It's a good moment for everybody. And I am quite confident that as we lift this at the city level, people are going to feel nervous. A lot of people are. And that's okay, and that is just fine to keep wearing masks for a while. That is not a sign of anything except continuing to care sort of for your neighbor. But please celebrate that you all have gotten us this far. We will continue. We are not going anywhere in terms of watching the data. You know that if we were to get into serious trouble again and we had to put masks on again, we would do that. I dearly hope we're never going to be there. But we're making sure we have all the good systems in place to monitor for variants, to follow what's coming. But we make decisions based on what our local epidemiology is here and now, what the risk is here and now. And thankfully, the risk is a lot lower than it has been. So COVID's not gone, it's not gonna be gone. But when we are at a place that it is in good control, that is a moment to lift those mitigations carefully and to continue to monitor and make those decisions. So thanks again for your attention and the thoughtful questions. Last question here from Mary Rodriguez on Facebook. She says, thanks for hosting these sessions. I felt well informed and empowered to deal with the pandemic. Do you anticipate continuing some periodic Q&A sessions beyond this COVID crisis? Yeah, we do actually. I'm very, I have really liked this format. It's been I will tell you, this is not a traditional format. It is much more typical, particularly if you're working in government, to have things be very tight and scripted and take questions far in advance and write them out. And there just was not time for that at the beginning of COVID. And I really, really like being able to take your questions live, because you ask questions that are not always the ones that I would think of, right? Of course, but when people are trying to imagine the questions people have, they're never going to do as good a job as hearing what questions people have. I know a lot of you write in with sometimes very critical questions, which is also fine. I want to hear what people are unhappy about. Especially if they're based on misinformation, I like to get a sense of that and see what folks are reading so we can address it. I've got no goal other than to make sure you are all informed with the best data that is available, and to help you sort of sort through that and to let you know how we are making decisions based on data here, balancing the public health needs with all the other needs, not just about direct impacts of COVID, but indirect impacts of COVID. So yeah, I do think we will probably be continuing some Facebook Lives. They're not going anywhere in the short term, but as you've seen, when things have been calm, we've often brought in other folks from other parts of the health department. We've talked more about, mental health and substance use and violence prevention and other things that have had indirect COVID impacts, and we're going to continue doing that even when COVID isn't here. So I do anticipate that we will be continuing this probably in a long-term way, as long as there are people who remain interested in it, because I've found it super helpful. And we were doing it 7 days a week at the beginning of the pandemic. We've done it at least twice a week the whole time through here, and I think it's been really helpful for me, and I hope it's been helpful for you. On that note, thank you. We will be back on Tuesday, the day after we'll have lifted the requirements. And so I will see you all then. And in the meantime, please take care. Thank you.